Good morning, good morning, good morning. Happy Friday Eve, as my partner said earlier today. Thank you all so much for joining us for our second Integrated Practice CANS, IP CANS, and Child and Family Teaming, CFT, Fidelity webinar. Our topic for today is the County Practice and Improvement Plan, which you will hear referred to throughout our time today as the CPIP, and the data sources that will be used to help to inform your county practice and improvement plan. We will be here today from 10 until 12 with a promise for at least one brief 5-minute break. I am joined today by Richard Connect, who is a managing partner with the Integrated Human Services Group, April Fernando, a consultant with the California Department of Social Services, and Robin Emme, who is part of the CDSS System of Care branch, which they are now called the CANS CFT Support Unit. And myself, hosting today's webinar. My name is Emma Black, and I work as a Child Welfare Workforce Development Manager with the UC Davis Northern Academy. Before we jump in, I am seeing that lots of folks are saying hello and sharing who is in the room in the chat. Please continue to do that. We love to know who is joining us today. If you can share your name, organization, or role, anything else fun that you want to share in the chat, perhaps something that you're looking forward to today or this weekend. We are just so grateful for your presence today. Some friendly reminders about webinars. We cannot see you or hear you. So there is the chat function where you can chat with the panelists and chat with each other. We also have a question and answer feature for today's webinar. We strongly ask that if you have a question, you find the Q&A feature and post your question there. That really helps us to keep track of the questions that are asked and whether or not we have responded with an answer. We will also try to keep an eye on questions that are coming through in the chat. Today's webinar is recorded. It is being recorded. The recordings will be posted shortly after on our IP CANS and CFT Fidelity series website. So if you haven't had a chance to look at that website, our recording as well as the materials from the last webinar are posted to the website. And then we also have a link for materials for today's webinar, and to try to increase access to materials, because we heard from you last time that some folks cannot open Box or cannot get to materials on Box. We also sent out an email yesterday that included several attachments with a reminder about today's webinar. So hopefully everyone has access to the materials, and if the email or the link are not working, please let us know through the chat or the Q&A feature by sharing your email, and we will do our best to get those to you. All right, so this is our agenda for today. Welcome. We are so excited that you're here. We will have a presentation from Richard Connect on system of care alignment and the importance of teaming and assessment from a system of care process and perspective. We'll have an overview of the County Practice and Improvement Plan, or CPIP, which is described in All County Letter 2554. We'll also discuss some strategies for completion of the CPIP. What can you be doing now to start to prepare for a good CPIP completion process? We'll talk about the Integrated Practice Child Adolescent Needs and Strengths, or IP CANS, and CFT, Child and Family Teaming data sources. It's going to be really important to know what those are, so you are accurately informing your county plan. We'll have some time for questions and answers. And of course, we will wrap up with getting some feedback from you all and introducing some upcoming engagement opportunities. Before we dive into our first presentation, I would like to invite you to join us on Mentimeter. My partner Joanne should be sharing a link in the chat shortly. You can also take out your smartphone or phone and scan that QR code, or go to menti.com, code 52303374. And I'm seeing some thumbs ups on the Mentimeter, letting me know that you have found your way there. So we'll give it just a moment for additional folks to join. Thank you so much. All right. So our question for today is, system of care work is, and then you have the opportunity to respond with words or a word or even a phrase that describes what comes up for you when you hear the term system of care work. So far it looks like there's some agreement that it is complex, constantly changing, grounded in collaboration, multifaceted, can be overwhelming, vital, necessary. We'll give a moment for some more to come in. A little stressful, helping others. I'm thinking maybe that's in the community, rewarding, progress, family bound, intricate, a lot, foundational, necessary. We're seeing that collaboration, complex, collaborative, needed, and important are becoming bigger and bigger. That means we're seeing some agreement around those terms. I see organized as well, constantly changing, progressive, abundant, stressful. Awesome. All right, so we're going to let these continue to trickle in. And next, I'm going to pass the mic over to my friend and colleague, Richard Connect. And he's going to talk to us today about system of care work and alignment in the teaming and assessment process.
Emma, thanks, and happy Thursday morning. So happy to be in conversation with you all and to be in partnership with April and our state partners and our UC Davis partners in what, for me, is one of the most energizing conversations of the last decade in California when it comes to child and family services. We are finally at this point when the contextual work of interagency integration system of care under 2083 and the system of care work that happened under KDA and CCR has built to this moment, this very moment in our developmental time together, that we are ready to implement with Fidelity the evidence-based tools into an environment of healing, child and family teaming. It's so exciting for me. So really happy to be with you. Mindful also, as we advance to the next slide, please, that you all are holding tremendous obligation and responsibility now. And if you're in, whether you're in child welfare or behavioral health, probation, or one of the other partners aspects of the system of care, we're all holding tremendous reform obligations and opportunities. And so just please know that I have just deep appreciation for the heaviness of that work, the difficulty of that work. We saw that reflected in the Menti polling that Emma just led for us. Just know that we get how heavy it is, and we also get that it's worth it. And we're going to talk a little bit about why it's worth it. So in the next few minutes, we want to explore a little bit about how and why the system of care memorandum of understanding under AB 2083 is critical to your eventual success as implementers of CANs and teaming. There's a strategic intentionality to the system of care MOU that supports our CANs work, and we're going to talk about that. We want to also spend some time after I've kind of set the stage, so to speak, with that, to understand how the rates reform work and other aspects of child welfare and behavioral health services reform can be enhanced by the system of care work that either you or some of your bosses are doing in local communities. Next slide. By way of quick context, really important to understand that all system of care work shares a common mission: to keep children and youth at home in school, safe, and in community, out of trouble, right? Teaming and assessment are universally practiced by all system of care partners, including schools and regional centers and their vendors. We don't always call it child and family teaming, but the teaming process, which is universally intended on healing in community and context of the family's needs and experiences, is fundamental to all parts of our system. So while we're focused on the use of CANS and CFT within a welfare probation environment, the constructs we're talking about and the MOU under 2083 are intentionally and potentially applicable across the healing spectrum, if you will. And here's what is super exciting, is that the IP CANS in California provides this extraordinary potential to realize this uniformity of care and service delivery that gets us to this point of being authentically, genuinely whole child ready, whole person ready, right? We've given lip service to this construct for decades in healthcare, both public and private systems. It's not a condemnation of public services, because private healthcare has always used this word and not done the heavy lifting of integration. So by way of context, this is why this is exciting, is we are at the point when we can translate all of this into a Fidelity-based practice going forward. It's whole child work, finally. All right, some additional context, a little more on the practical clinical side, and I shared this with great sensitivity that we have grown up largely in California and across the country in an environment where teaming has taken on additional expectations beyond simply being a place where people hold one another's trauma and acknowledge that people have been harmed and are suffering, right? And so there's this universal and primary purpose in assessment in all clinical settings, that assessment is about understanding. And we sometimes get stuck in the use of a tool or the forms in use or the way we do the work that takes away from this fundamental imperative of recognition that assessment means understanding. I sometimes have thought to myself, if we could replace the word assessment with the word understanding, we might be able to better engage kids and families. The IP CANS is a unique tool to support that understanding process, and it's been a few years since the state got into alignment on this at the departmental level in Sacramento, but let's pause a moment and just reflect on just that step alone of just identifying that we are going to use one tool and make a commitment to that. And we're now 5-6 years beyond that, and again, that's what's exciting about the moment. Absent an authentic understanding of the child and family's experience via assessment, the entire engagement and healing process will be ineffective. You know this if you've studied ICPM or the related constructs in wraparound, right? Like if we have engagement, everything else in the treatment works. If we don't have engagement, we struggle to do everything else in the treatment episode. Engagement is first for a reason. So these are all super important contextual items as we talk about then how do we put CANS and teaming into high fidelity practice. Next slide. So orienting quickly, acknowledging that many of you may not be super familiar with the Assembly Bill 2083 and the Memorandum of Understanding that supports the system of care build in California. There are evidence-based, evidence-informed functional aspects to what organizations do together that are captured within that MOU. This is all by design. There are 11 of them. We've highlighted 7 of them here. 4 of them in this beautiful, I don't know, was that violet colored, and then 3 of them in blue. And we're going to talk a little bit more in detail in just a second about what these 7 elements in particular have to do with your successful fidelity to CANS and teaming. So just pausing here again to reflect that your managers, your deputies, your directors, not just in welfare, but their partners, have crafted an MOU that is intentionally set to bring us into this place where these 7 elements in particular, if done with any kind of sustainable consistency, will create the conditions for successful implementation of CANS across the spectrum, right? And so let's dig into a few of these. Thank you very much for the slide help. So there are 4 elements within Assembly Bill 2083 MOU that by design support the practical delivery of assessment, engagement, teaming, service delivery, transition, care coordination, all those functions, right? And those are, and again, acknowledging that in your local MOU, the numbering, the sequencing of these might be different and the nomenclature might be slightly different. So the nomenclature we're using today, screening, assessment, and entry to care, child and family teaming, that's what we call it at the state level, right? But again, your local nomenclature might be slightly different, but you have a function in your MOU that captures that and everything else we're going to talk about in the next couple of minutes. So elements 4 and 5, again, they might be somewhere else in your MOU, but they invite you and your bosses, right, to make a set of commitments to how are we going to help and support families to be screened, identify and understand their needs, enter care, like what's the no wrong door methodology like in our county, right? And then once they're in the door, how do we team with them? The element 6 in the MOU suggests that interagency placement committee, which is nothing more than an enhanced teaming process, right? And it's used in various ways, shapes, and forms in our counties, but it's just a teaming process at a higher level for kids with complexity who have needs that the team maybe has not been able to address, right? How do we develop resources to meet those complex needs? That too is in the MOU by design. And that IPC process has to be informed and connected to the CANS information, right? That's why it's in the MOU. Element 7, the alignment and care coordination, suggests that when we do appropriate screening, assessment, teaming, when we do IPC work, all of that is designed to help us on an interagency basis align and coordinate the care so that there can be one team, one assessment, one plan, whole child, singular aligned work, right? So 3 of these 5 system of care partners currently use the CAN. So of the 5 signatories that are obligated under AB 2083, child welfare and behavioral health now, with real clarity, have to use the IP CANs. And and applied to some of our foster youth in probation, right? Their obligation begins, I think, January of next year for probation to begin using CANs. So we have, again, 3 of 5 partners who are now in California wonderfully. It's difficult work we're talking about, but wonderfully, we're in a place now where the vast majority of the kids who are the subject of the system of care are going to have the same tool in place to help us understand their needs. So when they pop around the system, there's a common methodology, understanding, and a set of agreed to ideas about what are the strengths, what are the needs of this particular kid in the context of their own experience. So this is amazing work in California. Some of you, if you're gray bearded like me, you would have never guessed 15 years ago that we would have gotten to this place in California. It's really quite amazing. Next slide. So 4 elements at the practice level, 3 elements at kind of the functional level, right? So we're coming up to address what do organizations need to do so that the practice elements of the MOU can be effective. Element 3, how do organizations share data? How do we mitigate the privacy, the HIPAA and the FERPA, right? How do we make data available so that we understand whether the system is working? Really difficult work, but the purpose of the MOU under 2083 is for partners to help each other figure that out so that you can share CANS information in a timely, fluid, dynamic way, right? If you don't address the systemic problem, then all of the intentionality for one CANS won't work. You see the connection between the systemic elements that are in the MOU, they're in there for a reason so that the practice elements can function. Information and data is one. The way we recruit, support, coach, train staff is another one. We have to make sure we're training people to not just IP CANs use in a collective singular environment in each county, but things like motivational interviewing, things like integrated core practice model use, like all of these things can be co-trained to and should be co-trained to so that you get the alignment, so that we're out of our silos and we don't have different perspectives about what does that mean to use a CANs, right? Element number 9 is the revenue sharing and maximization, because all of the obligations that come with healing, being a healer in California, take time and money, right? And if the organizations aren't tuned into that, then when those money problems arise, which they inevitably do, we're in one of those cycles right now, right? Then how does the system hold itself together so that the teaming can be coherent, sustainable going forward. All right, so thank you. Elements 3, 8, and 9 are in your MOU to support the system. The other ones are there to support the teaming. All right, orienting you a little bit deeper really quickly to Assembly Bill 2083 in the MOU, a couple of quotations lifted from the state's guidance. Okay, so the purpose, and this just is to reinforce what we've been talking about, the purpose of the MOU is to create and ensure a system where partners and the partners' programs and policies reflect high coordination, integration, effective delivery of services for kids and families that are the focus of care, right? And to address the systemic barriers. This is important language. The AB 2083 MOU was written. The system of care was implemented back in 2018 to let us address the systemic barriers to the traditional provision of services. Those barriers are what create gaps through which families fall, right? And then we wonder, like, what happened? Like, how come we put so many resources in California, so much money into the system, and we don't get systemic improvement? It's because the wholeness of the system doesn't hold the implementation work collectively. And so it's not maximized, it's fragmented, and it's siloized, right? So we're creating a oneness to the system so that a wholeness to the system so that whole person care, whole child care can be effectively delivered. There's great intentionality again to the MOU work. Next slide. It matters because in high functioning, mature systems of care, there are demonstrable outcomes that are all the outgrowth of good teaming, right? And so the good teaming, which is dependent upon not just teaming behavior, but systemic organizational interagency behavior and the vision to hold ourselves in wholeness and oneness, yields lots of great outcomes, including these and probably 3 dozen others. This is an abbreviated list, comes to us from our good friends at Georgetown University Technical Assistance Center many years ago. And again, there are demonstrable outcomes that come, this is important, not just from more money to do more teaming or more CANS use. These outcomes that you're looking at on the screen actually came from systems where they didn't necessarily implement further programs and services. They didn't build more programs. They simply got in the sandbox together to coordinate the services they did have. So the outcomes we're after come from high levels of coordination and system integration, not necessarily building new programs or implementing new services. This is important realization in California, where we have historically said to ourselves, oh, we have a problem over here, let's throw some money at that problem and we'll fix it. And it's not that easy. And we've often not maximized our experiences because we haven't done the heavy work of integration. All right, next slide. A little bit wonky here, but further understanding about the system of care invites us to some realization that as implementers of IP CANs and teaming, it's important to understand this, that in every one of your counties, you have an interagency leadership team. Now, in some counties, they're functioning pretty well. They meet every month. They have dynamic conversations. They're talking about the stuff they should be talking about. And great empathy that in some of your counties, you may be implementing IP CANs and CFT where the ILT is not functioning very well. All right, let's just acknowledge and name that. And so you're going to have some additional work to do to kind of manage up potentially, to try to encourage your senior managers, your executives to say, hey, can we get together? Can you all get together and figure out what does that MOU mean in our county? And can we talk about how do we do teaming? How do we do assessment? How do kids enter care? How do we coordinate, right? All of those things. And in most counties within that interagency leadership structure, there's a second level. It's sometimes called an executive advisory committee, might be called a children's interagency advisory committee. There's no particular terminology to it, but that's the senior managers, the deputies, sometimes senior supervisors who are charged with kind of executing the vision of the ILT. And then this graphic in particular calls out the intentionality of implementation of all of the reform work. So we could add, for instance, in one of these colored modules at the bottom of this box, IP CANs implementation, right? So in many of your communities, you're working on things like BH Connect, high fidelity wraparound, brand new, right? Implementation of community schools in some school environments. There's CalAIM. Like the system of care has room for and should be the conduit to implementation of all things, including IP CANs, all right? So in your mind, imagine that add another nodule on this, another arrow, that says that interagency leadership team should also be concerning itself with how faithful we are to CAN's utility and to teaming effectiveness. All right. And then over on the left-hand slide, give me one more second on that slide. Thank you. Over on the left-hand slide, you see the element, the reference to creating hospitable conditions. The role of the interagency leadership team, your bosses, is to create the conditions that make it possible for teaming to work and for CANs to be universal and singular. We have to pay attention to, again, the things in the MOU. How do we share money? How do we share information? How do we team? How do we train? Do we co-locate? Those kind of things. All right, next slide. Thank you. All right, just to drive home the wonder of this moment, the beauty of this moment that we have collectively kind of rode to for many years now, all of us and many others, and those who came before us. We're at a place where we have in California an independent practice, an integrated practice CANs, IP CANs, and 3 of the 5 partners are obligated to that use now. And by contract extension, our community providers should also be obligated to that singular use of IP CANs. And if not, that's a developmental step for you to take, right? Like making sure your contractors are using IP CANs and that they can help you solve the information sharing. And so the CANs now is fulfilling its mission for which it was dreamed of, 35 years ago, right? Like it's the center of the system. It aligns us around a common understanding about strengths and needs for every particular kid. So we're in this place where the coherence of the system is going to come together around the CAN. This is amazing, amazing work. Super, super excited about it. Next slide. All right. The benefits, in addition to some of the ones we already talked about, is that on the system level, we're going to create additional impact that is going to sustain us going forward into future generations of healers in California. We're going to establish a culture of trust at a much deeper level. It's going to, in other words, it's going to enhance practice, right? We're going to create clarity for kids and families because you all know 35% of our kids in child welfare are in somebody else's county at some point in the care episode. And some of that's intentional and necessary, right? But when kids move from county to county, having one CANs might be really powerful, right? It's going to inform the integrated planning process in ways that we've not heretofore seen. If we do all those things, we're going to get reduced stress on caregivers. So everybody associated with the care team will experience reduction in stress. And I'll just point out for a second here, it's not just reduced caregiver stress, it's reduced stress on us as professionals. And if we get reduced stress as professionals because we get better alignment, our job satisfaction goes up, our burnout goes down, we get better healers, right? And the workforce gets sustained. So there's this double win in a high fidelity CANs practice. Ultimately, we're going to build on experience and create a culture across the state of California that says, this is how we do our work. We understand wholeness for kids and families, and the CANs and teaming is our tool. Next slide. Really quickly here, Robin's going to share, and our CDSS folks are going to share a little bit later, greater details here. But one of the things that's super exciting, and we want to celebrate the Department of Social Services and their partners at DHCS and other places around development of some tools to support this. So we're unlike back when I had hair, the state often said, hey, counties, you guys do this thing. Good luck with that. Here's the policy guidance. Tell us how you're doing later on, right? Not anymore. Like CDSS has for years leaned in, understood that we have a technical assistance role. And the fact that we're gathered here today with 175 people to talk about how the state's going to support this is amazing. And these are the tools, and Robin's going to tell you more about them later on. But just pointing out that there are amazing resources that have been developed over the last decade. That pioneering work is rolling into these tools, which are going to support Fidelity in ways that we haven't seen before. Next slide. So wrapping up then, and with great appreciation for your time and energy with me this morning, some recommendations for you to think about, all right? So no particular order or importance to these, but some of the things I would recommend if I were in county land working and coaching on some of this stuff, I would encourage you to use your interagency leadership team to establish a cross-agency work group, behavioral health, probation, welfare at the least, right? And maybe in some counties, even schools, because some of your contracted partners are also in school environments where they should be using CANs or they might even be already, right? So think about do our school partners in our county need to be involved in this conversation? Form a work group associated with your CPIP work that we're going to talk about later, right? And bring them into an alignment around how are we going to do this one system, one policy in our system, right? And to that end, inquire with your county education and your local education authority folks if they or their contractors are using cans. You want to do some inquiry. It might take you a minute. Here's the thing: in a big county, if you're in a larger county, you might get different answers because the LEAs are independent, the school districts are independent, and sometimes the county office of education doesn't know, and they won't know, right? Like, where is cans being used? And so they'll come to you and they'll say, we're not using cans. There might be some school districts where they are using cans, right? So be patient as you conduct that inquiry, but the more you can invest in that process, you're going to position yourself as a county for sustained fidelity to practice, because you're going to know where the broader environment of cans is occurring, right? I would encourage that work group to come back to the ILT probably twice a year, maybe even quarterly, and say, this is how we're doing. This is what our CPIP process is like. This is what our fidelity work looks like. We just want you to know, as big bosses, this is what we're doing. Really importantly, please don't create separate policies within probation, behavioral health, and welfare for how we use one cans. Don't do that. Make a commitment right now that we're going to do one policy and we're going to share it across the system. That's the way you sustain the structural aspect of the wholeness, right? Otherwise, you've got 3 policies. They're all subject to drift. And then 3 years from now, other people are going to inherit the work and they're going to wonder, what does that mean? We got 3 different policies going on, right? Identify ways that leadership can support staff in doing their work. So manage up. We've already talked a little bit about that. And finally, 2 more things. I would encourage our supervisory personnel to understand their key coaching roles. So training to integrated core practice, training to IP cans, training to teaming is one thing. If our supervisory personnel are not focused in their one-to-one supervisory sessions on the effective practices, then we're missing that key component of practice change, right? So bring your supervisors into alignment around the critical role they have, and then ultimately recognize also that the integrated core practice model is the system of care's practice model, and that there's a critical link here to understanding the power of empathy and empowerment as the change process. Remember, in other words, child and family teaming and CANS use are not technical functions. They are healing human functions. And if we can remind ourselves continually, which is what ICPM tries to do, that we are engaged in the process of healing. We're not here to complete forms or to finish CANS tools. We're here to use those tools to heal people. We've got to have that front and center. Then we'll get to success ultimately with the faithful practice here. So I think maybe one more slide in transition. There's more information out there. You can find it at these 2 sites. And again, tremendous resources in the environment, and deep appreciation again for the work you're doing. And I'm going to yield back to Emma.
Thank you so much, Richard. Every time you talk, I just have some new, like, resonant takeaway, something that just vibrates within the soul of my soul as someone who came to child welfare practice work as someone who wanted to really heal and help families. So thank you for reminding us of that and of the power and importance of really doing this work together. Because if any of you have worked in child welfare, behavioral health, probation, or some other form of direct practice work, you know that you cannot do it alone. It's just simply not sustainable, and it's not what our families are looking for when they come to us needing help or being required to receive help. So thank you so much, Richard. I apologize, my screen share briefly interrupted, but what I was trying to share in the chat is that part of the work that we have been doing through a statewide CANS curriculum work group is to update the existing training curriculum. We updated what was called the CANS and supervision training to really focus more on coaching to practice integration, really thinking of that system of care audience and really the importance of leadership having a stake in the implementation and use of CANS. So in the materials link, we have pulled out a document from that training. It's called Questions for Leaders to Use to Deepen something around use of the CANS but we really think it's a good document. It's really intended to come up with strategies to be reflective in time with staff. And any of you who are in this webinar, you're a leader, whether you're technically a supervisor, a manager, or a director. If you are a person who has a stake and interest in the well-being and thriving of families in your communities, you are a leader. So please look at that document for some concrete strategies that you can take away. And then we do have a couple moments to ask questions specifically to Richard before we move on to the rest of our presentation. It looks like some questions have been answered live already through the Q&A function. Richard, I don't know if you have any thoughts about just the challenges around where the CANs is required to be stored or documented. Those are currently different for child welfare versus behavioral health.
Yeah, and no easy answers here. And again, great empathy for not just those of us in the practice area, but for this in the state for navigating high levels of prescriptiveness, statute, code, bureaucracy, right? I think we're working on it at the state. I'm sure that Robin and her team might be able to talk a little bit more about this. I think we're mindful of it. There are workarounds, but at this point, yeah, there's a fair amount. There is still some redundancy in the system, and we're just going to have to kind of noodle our way through that. More critically, I see question 1034. My agency never receives a copy of the CANS assessment. Challenging if that's still the case in your county. And again, great empathy for you. This is a conversation that your managers really have to have, and it may involve county council. I would encourage them to reach out to the state for assistance in this area. If you're still stuck in an environment where one agency is saying, we can't show you the CANs, then you're way behind the curve. And you're honestly, I'll speak frankly, your lawyers don't understand HIPAA, all right? Because there's nothing in HIPAA that says we can't share the CANs. In fact, HIPAA suggests you have to, you're obligated to. The portability part of HIPAA suggests information is portable. And that means it moves across the system. So there are conversations needed because some of our lawyers have a profound misunderstanding about what privacy means in a context of care coordination. So you have to noodle through that, but your managers have got to address that and approach that from a systemic solution, because you'll never be able to move the needle in your CANs practice and your CANs sharing.
Thank you so much, Richard. The one other question that I think was directed towards you is, do you have a guide or a template on what a joint IP CANs policy should look like, or key criteria items?
Yeah, there are a couple of examples, and we can potentially follow up with y'all. We want to kind of vet those with the state a little bit first and make those available to the environment. But yeah, there are one or two examples that we can share.
Awesome. So we will try to get those out to this group. Richard, I know you have to log off to get to something else, but again, thank you so much. Folks, if you can find your emojis and just give Richard some gratitude for joining us today, that would be lovely. And Richard, I know we will see you soon, and have a good time in Humboldt. All right. So we are going to move back into a Mentimeter question to get us rocking and ready for the next segment of our presentation. So Richard just spoke really so beautifully about why the IP CANs, but we would love to know from you all who have joined us today, why the integrated practice CANs, or the CANs, and child and family teaming, or the CFT process. So again, this is a word cloud. You can use the same link as before. It has been shared in the chat, or you can go to menti.com, code 52303374. Oh, and you can also scan the QR code in the corner of the screen. All right, I'm seeing collaboration, fidelity, helping, consistency, listening, getting buy-in, better supporting the I think foster youth, teaming, collaborative care, working towards buy-in, having a natural process, being family-led, helping, communication, family voice and choice. Absolutely. One of the things I just want to uplift before I pass the mic to my partner, Robin, is that the IP cans and CFT process are absolutely crucial for youth and non-minor dependents, and they are a required process to support parents and caregivers who are involved with and navigating our family serving systems. And one of the ways that I have seen the IP cans used most powerfully in the child and family teaming context was actually to help to identify some unmet needs for a mother who was struggling to complete her case plan requirements. And there was a lot of concern about her inconsistency with visitation and not attending some of the required classes that she had been ordered in her case plan to complete. And the IP cans and the cans discussion in the CFT meeting really helped to bring to the table the fact that she had a significant medical condition and was dealing with a chronic illness that was not being appropriately treated. And I don't think the team would have had that discussion if it weren't for the CANS completer really bringing that in a very trauma-informed way to become a tool for that mother to advocate for the case plan focus that she needed. So I just wanted to share that story because I think we can get really intense about some of the requirements. And as someone who has seen this work in practice, I have seen it be really effective to help to make sure that we're focusing on the right things. So next, I'm going to hand it to Robin.
Good morning, everyone. As Emma said, I'm Robin Emme. I'm an analyst with the CFT and CAN support unit, formerly the Integrated Services Unit. And you can see I've got my team here and also Caroline on the line. So we're excited to be here and talk about the CPIP and Fidelity efforts with you all. So as many of you likely already know, the Fidelity ACL 25 or all county letter 2554 was released on August 26th. So not too long ago, hoping people have had a chance to kind of read it a bit more and dive in, but we're going to do just a brief overview of kind of what was included in the letter itself. So the letter does provide place and agencies, tribes, and system partners with information and guidance on requirements related to IP cans and CFT Fidelity, and in preparation for the California's tiered rate structure, or TRS. It includes key information on CFT and IP cans and the tiered rate structure. It also includes cultural considerations that should be integrated into practice. It emphasizes engagement with the partners and tribal communities through a CQI and Fidelity work group and our listening sessions that I'll talk a little bit more about in a few slides to really help ensure broad input and alignment was incorporated into the Fidelity plan. So it goes into those efforts there. As I kind of said, it does have highlights some cultural considerations and talks about the importance of incorporating culture into all domains of the IP cans and making sure that the assessments and plans are respectful and inclusive of the family's culture, the youth and families culture. It also has the Fidelity plan. So the Fidelity to the IP cans and CFT practices. It introduces a new system level Fidelity tool, which is that CPIP that we've been talking about, the County Practice and Improvement Plan. It also has guidance on case level Fidelity tools to support practice at the individual level, and has information on using data reports to monitor Fidelity, and also some additional information on training, coaching, and technical assistance that's built into the framework. I'm going to touch on those on the next slide as well, a little bit more, but also included in the ACL itself is more information on technical assistance and support and updated training requirements. This ACL actually contains information on both IP CANs completion and CFT meeting facilitation trainings, and information on how staff can access these trainings. So it has information, a table in there that kind of goes over the role-based training updates. So I'd recommend taking a look at that. It highlights the importance of and the requirement now for partners working with the place and agency to participate in the statewide standardized IP CANs training. And CFT meeting facilitation as well. So that would be behavioral health partners or community-based organizations that are either completing the IP CANs on behalf of a place and agency or facilitating meetings on behalf of them, and stuff as well. So those be included, but more information can be found in the ACL itself. We can go on to the next slide. This is where I'm going to be diving in a little bit more to what the plan is, but I'm still keeping it relatively high level. At the last webinar, we dove into the CFT brochures and CFT meeting survey. Over the next 2 webinars and learning labs, we're going to be talking about that county practice and improvement plan you see on there. But I just want to highlight kind of the flow and how it fits together here. So what you're seeing is how the different elements can all fit and provide a thorough picture of IP CANs and CFT practices. The CFT brochure is provided to the youth and family and team members prior to their first CFT meeting to assist with engagement and their understanding of the processes. And then starting in January 1st, 2026, the CFT action plan is then used during every CFT meeting and provided to the court. The action plan then captures CFT meeting and IP CANs information, records action steps, and ensures that the youth and families' perspectives were accurately represented and linked to the services. And then during the CFT meeting, or during select CFT meetings, not all CFT meetings, starting after April 2026, the CFT meeting observation tool will begin to be completed. So this tool captures the family's experience and meeting effectiveness. So there's somebody that comes to the meeting itself and observes and kind of rates kind of what happened during the meeting, and then does a debrief as well. Then following the meeting, you can see the arrow kind of going to the right. We've got the CFT meeting survey. So that's provided and encouraged to all CFT members in order to receive feedback of how they felt the process went. And then in addition to the meeting process itself, the county practice and improvement plan, or the CPIP, is completed by each place and agency, both child welfare and juvenile probation. And then we also have the IP CANs Fidelity review tool. That's a tool that's still under finalization, and that tool is intended to be utilized by CDSS staff. So more information will come on that at a future date. So move forward. All right, thank you. And this is that timeline. I did talk a little bit about the timelines during that last slides, but as you can see, we have a bit of a phased in approach. At the beginning of this month is when the CFT brochures and CFT meeting survey were required to start being disseminated. We also intend on having some technical assistance guides posted by the end of the month, and have our level 1 and level 2 technical assistance live. As you can see, also in August, I didn't start there. As I said, our ACL did launch in August. We also have a Fidelity webpage that has access to the individual attachments that were included in the ACL, and also additional resources that can help with the Fidelity efforts. And then in January, the County Practice and Improvement Plan, or again, CPIP, is due, the initial submission. This is due annually, and that begins again January 2026. And that's what we'll be diving into today, hence why it's highlighted there. But as you can see, also in January is when those CFT meeting action plans begin using. And then in April, we begin to see the use of the CFT meeting observation tool, and the IP CANs Fidelity Review Tool testing will begin. We're hoping that the IP CANs Fidelity Review Tool will be going live then in July after some testing of 2026. That's also when CDSS will begin monitoring some of the data more closely and reaching out to counties with a level 3 technical assistance. So we have more information on that in upcoming slides as well. I think we can move forward And during this break, I will try to slow myself down. I know I'm talking very quickly, and it's a lot of information I'm throwing at you guys. But after the break, we are going to come back and actually dive into the CPIP a bit more, that County Practice and Improvement Plan.
Thanks so much, Robin. We heard you in our last webinar that a short break would be nice. So we are now taking a 5-minute break. So break from now until 10:55, and we will see you back here shortly. Well, that 5 minutes went by very quickly. Robin, when you're back on and ready, just let me know. I do just want to remind folks that if you have a question, it's very helpful if you put it in the Q&A box feature so we can help to keep track of them. And Crystal, I saw your question about completing one CPIP between child welfare and probation. I do think that will be addressed shortly, but just a friendly reminder to all that if you have a question, please try to put it in the Q&A feature so we can keep track of it. And Robin.
Okay. Hi, all. Hope you had a nice break. I know it was short. We'll try to get a longer one in the future webinars, but glad we got a short one in there. So the County Practice and Improvement Plan. This is a collaborative self-assessment tool that's used by both placing agencies. I want to highlight again, I know I mentioned this before the break, but I want to highlight that this is the first of 2 webinars that we're actually hosting, and including their accompanying learning labs that will be exploring the County Practice and Improvement Plan. So like I said, this will be covering what the CPIP is and the overall completion, but then we'll be diving in further to kind of building out strategies and things like that in the next webinar. So feel free to keep putting your questions in the chat and we will answer them as they come in, or not in the chat, sorry, in the Q&A function. But if it's something that's a future webinar, we may also hold it for the next meeting too, but we'll try to answer it if we can. So again, this tool, it's a collaborative self-assessment that assesses the IPCANs and CFT, also the implementation practice. Is designed to be completed by each placing agency, both county child welfare and juvenile probation, in collaboration with their contracted providers. That could be the children's behavioral health teams or community-based organizations that are involved with their IPCANs and CFT processes. Placing agencies are also must interagency leadership teams and in the completion of this tool. Kind of as Richard was expressing earlier, it's that when completed collaboratively, we can get that comprehensive viewpoint and see, get a better accurate and understanding of what is working well and areas that may need improvement, and develop strategies together to really help the children and families that we're working with jointly. To further support the Fidelity efforts, there is a section of the tool that includes completion of an improvement plan that is informed and guided by the discussions. That section is what we're going to be speaking more about during the dive deeper into the improvement plan itself then. But we will be talking more about the actual completion of this tool as well. And this tool, I'll say it once, I'll say it again. I think I've already said it twice. This will be the 3rd time. It is required to be completed by January annually, beginning January 1st of this coming year, 2026. Next slide. So in collaboration with the UC Davis Northern Academy, we hosted 11 listening sessions in late 2024 and early 2025. We gathered input from counties, practitioners, tribes, and people with lived experience to understand what's working, what isn't, and what's needed to help with the implementation to reach fidelity of IPCANs and CFTs. An analysis of these sessions was completed by the Center for Innovation and Population Health, and we do have a copy of the listening session analysis available for review on our Fidelity website, which I think will be posted in the chat as well. What you're seeing on this slide here are some of the themes that were identified during those listening sessions and how the CPIP is actually responsive to them. So with clarity and consistency, many participants reported that there was, general enthusiasm for IP cans and CFTs, but they often encountered that there were different interpretations of how the processes would work. So that feeds into the CPIP structure, which is looking at consistency across counties and alignment with a Fidelity framework so that everyone's kind of using the same map as they're along this process. We also, the input also emphasized the family and youth voice, saying that families sometimes feel that they're not adequately informed or their voice isn't meaningfully part of decision-making. So to respond, the CPIP includes questions and ratings about how practice includes family and youth and how feedback in the surveys or other qualitative inputs are incorporated into the process. Then we also have our cultural responsiveness and equity. There were concerns about how the practices work for different populations, including tribal partners. The CPIP's system of care area, and we'll be talking about how the CPIP's actually broken up as well. It's broken up into 4 different sections, and one of them is the system of care. And that area focuses on partnerships and leadership and ensuring that there's equity in the IP cans and CFT processes, and looks at kind of those policies as well. Then there's some of those barriers that we heard about. There's issues with data access, communication, and resource constraints were some of the common ones we've heard. The CPIP, it isn't just asking counties to identify the problems, but it's actually asking them to plan improvements, to develop strategies and timelines, and determine who's responsible for completing those, right? And it really helps connect them back to the CPIP itself helps connect back to the technical assistance that's available as well. And then we have the Fidelity implementations and supports, different supports available. The listening sessions made it clear that having the tools alone isn't enough, that we actually need more of the training, coaching, and concrete support, which makes sense, right? So the CPIP thus is tied into that guidance. We have the technical assistance guides that are close to finalization and will be posted online hopefully by the end of this month, if not first week of October, in order to help guide some of the CPIP completion and strategy development and be available to help assist. And so again, with those tools, it's not helping just plan, but also helping to implement these processes with Fidelity. And so overall, the CPIP really does respond to the feedback that we heard during those listening sessions and through our work groups. It builds in that structured reflection of the counties. It includes family voice, equity, shared leadership with the involvement of the interagency leadership teams, and includes guided support. So it's a bit of the why there. We can go on to the next slide. Okay, so timeline. Again, CPIP is due January 1st annually. With this first submission due January 1st, 2026. So we are developing an online system where folks can submit their CPIP submissions, I guess, by January 1st. And that should hopefully be out within probably by the end of October. So that is forthcoming. And just noting again that placing agencies, both child welfare and juvenile probation, are able to submit separately or jointly, depending on where each of them is at with their IP cans and CFT practice. The CPIP is, like I said, broken up into different sections, and the system of care section should really always be completed as one unit, but there are differences as far as maybe where juvenile probation is at with their implementation of CFTs or IP cans, and where child welfare is at, considering child welfare has been required to use the cans and implement cans and CFTs for a number of years now, whereas probation is only beginning the requirement of the IP cans completion starting in January of 2026. So there may be different stages of where counties and placement agencies are at with their practice. So it may be difficult to complete that section together. So you might want to do it separately, but discuss again together. So there's more information and guidance on what it may look like if placement agencies are either completing the CPIP together or jointly within the CPIP completion guide, which you can find in the box link that has been provided in the chat a number of times. The CPIP completion guide will also be posted on the Fidelity website probably next week. It's been submitted. So that should be readily available as well, and does include more information about that submission. And actually this entire process in general. It's quite a robust document. But we also want to acknowledge that the capacity is different across the county. So it will look different. It will look different county to county. It'll look different placing agency to placing agency in some places. So it's really a team decision on whether or not you're submitting jointly or separately. And also there's some flexibility, so you can adapt to what sections you complete together or not. And there are definitely instances where a single CPIP may be able to be completed together, such as we've heard that there are some agencies where child welfare is the placing agency for juvenile probation, and their juvenile probation partners are already using the CANs. In that type of situation, it may make sense for the practice to be completed together. So with that said, I'm going to pass it off to April, my colleague, who is going to actually start diving in. Oh, actually, I'm sorry. I'm not going to do that yet. Let's go back. I didn't talk about the team membership. But April's going to talk more about those specific sections, and I think it'll make sense a little bit more about completing separately or jointly there. But let's touch on the team membership. Sorry about that. So team membership, I did say already that teams must include those identified partners that are assisting with the IP CANs and CFT completion, right? Again, that could be your behavioral health partners, it could be community-based organizations, but it could be other partners as well. And so they must be included in the conversation, in the ratings. And then the county's interagency leadership teams and tribes must also be consulted by the placing agencies as well. They should be a part of this conversation as well, in order to make sure that we have cohesive plans, again, for the children and families that we're working with together, to ensure that we are providing cohesive care and providing less stress to the families. So you can see the team membership with the interagency leadership teams. It does include like behavioral health, child welfare, juvenile probational, regional partners, educational partners. So there are a lot of partners already included on the interagency leadership team, but also juvenile court partners, those with lived experience, and tribal partners. Not all counties, I believe, have tribal partners included in their IOT. So just kind of looking at those memberships and who should be there. Okay, now I think we can move on to April and dive a bit more into the CPIP structure.
All right, thanks, Robin, and good morning, everyone. It's really great to see so many familiar names on the participant list and to be here with all of you today. I have a lot to cover, so I will do my best to also slow down. The CPIP has 4 areas. 3 are topic areas that help us retrospectively understand a county's IP CANs and CFT implementation and practice. So the first area is that system of care topic area, which helps us reflect on the county's leadership process and structure and how the IP CANs and CFT is utilized across the county. This topic area also helps us review whether things are in place, such as local policies and procedures that facilitate effective IP CANs and CFT practice. Those policies and procedures might need to be adjusted to really reflect the local situation, because not all counties, as been said before, are the same. Documentation for sharing of CFT and IP CANs data and resources for effective IP CANs and CFT practice, be they human resources, technology, or funding and contracting. So those are all covered in the system of care topic area. The second topic area is the practice topic area, and it's the most expansive, with 3 subsections that really help in understanding whether there's practice with Fidelity in the child and family teaming process, in the IP CANs practice, and whether the integrated core practice model is being applied between both of these approaches. The third topic area is data, how CFT and IPCAN's information is being monitored and reviewed, how it's being used for decision-making at the county level, and how this information is communicated then to staff and other stakeholders. And finally, in that last box on the right-hand bottom corner, is the improvement plan. It's the prospective aspect of the tool. And that area helps us articulate the plan to build our county's strengths. And we want to do that in this instance through effective CFT and IPCANs practiced with Fidelity. So if you look at this tool as a whole, right, the CPIP is both reflective and forward-looking. So I could get the next slide, please. So this is the ICPM, the Integrated Core Practice Model area in that practice topic section of the CPIP. And in case you haven't reviewed the document, we wanted you to see what this looked like. So this ICPM informed IPCANs and CFT practices has several statements, right? The statements are labeled A, B, C, D, etc. So if you think about this, you have 2.4A, 2.4B, etc. Each of these statements are what the team that Robin identified earlier will be collaboratively rating. Okay, and to reiterate something else that Robin said, the goal of the CPIP is really to identify gaps in the county's IPCANs and CFT implementation as well as their practice. So this gap analysis, if you will probably be done by a team of those system providers working together. We hope to focus this effort on identifying areas that, once they're developed, could be seen as strengths that could support everyone across the county, the staff, the partners, the providers, and of course, the children and youth and families who are receiving care. So what we're trying to develop here is a learning process where areas to be developed are identified, as well as a learning community that's brought together to aid and support. So support in conducting this gap analysis, otherwise known as the CPIP completion, are some TA providers that Robin will talk about more in a bit. As a preview, these individuals may be from your own county staff or a Cal Academy, formerly known as the RTAs, or from CDSS. So as Robin said, we've created this CPIP completion guide that facilitates the process of figuring out how to complete this CPIP document. All right, if I could have the next slide. The CPIP completion guide, by the way, is a 63-page document which provides a 3-session, as it notes here on the slide, 3-session suggested meeting structure for completing the tool. I'm going to provide an overview of 2 of these sessions. The 3rd session is the focus of our next webinar, which is on October 9th. So one of the first steps in approaching the completion of the CPIP is for the team to determine a timeline for completion of the tool. So some things to consider is your county size, the number of team members, and the time you think you'll need to complete the tool. For smaller counties, the time commitment might be 3 60-minute sessions. For larger counties, you might have more sessions or longer meetings. It really depends on what you all need. Whether both county placing agencies are submitting a joint or separate CPIP, which Robin described previously, that's another consideration that you have to take into account. If county placing agencies are submitting separate CPIPs, more time may be needed, or you might need an additional TA provider to help with that process. The number and length of sessions to complete the CPIP may also depend on whether the team will do work in between the sessions. So the team's culture needs to also be taken into account. So is this a team that maximizes collaboration, prepares, and has productive working sessions? Or do they do best when they work in smaller teams or individually on aspects of projects in between sessions? All of these things are things we need to think about as you're completing the CPIP. If I could have the next slide. So the title of this slide is CPIP Consensus Building. In reviewing this slide, however, I think I would add teaming to this title. Teaming and consensus building. Why, you wonder? Well, there are some other aspects of the CPIP to consider. Excuse me. Not too unlike the CANs, the CPIP is a communimetric tool that helps us understand what and when to support. In this case, we're trying to determine supporting a county's implementation and practice of CFT and IP CANs. The CPIP uses action levels, as you see here on the left-hand side of this slide. As the goal of the CPIP is to understand a county's current strengths and how to develop or build their strengths, then we use a strengths rating scale. And this, for those of you familiar with the CANs, this rating scale should be familiar with 0 being a strength is fully accessed or even a centerpiece strength, to the rating of 3, where there is not yet a strength identified. We have to help identify and then build that strength. This rating scale is introduced and discussed in the very first session with the team to make sure they understand how the rating scale works and how to apply it to the CPIP statements. Consensus building at the top of the right-hand column is a central aspect of a communimetric tool. And as you know, it's a process of seeking unanimous agreement, which involves good faith effort in trying to meet the interests of all the stakeholders. So consensus has been reached when everyone agrees they can live with whatever is proposed after all the efforts have been done to make sure different perspectives are heard and to meet all the interests of those that are on the team. So time will be spent with the team discussing this process of consensus building and its importance in completing the CPIP. And finally, informed consent, right? There's time that's also going to be spent by the TA provider obtaining verbal informed consent from the participants in this completion process, right? To collect and use the team's responses, to understand the implementation status around the CFT and IP CANs, and also to inform the development of the CPIP. The goal here is to make sure that all the participants in the completion process understand the purpose and the value of these conversations and also feel comfortable in sharing their thoughts and their experiences. The team is also informed by that the responses that they share won't be identified by individuals, but rather as themes that the team will identify. So we really want to encourage open dialogue and expression. All right, so I'm going to turn this back over to Robin.
Y'all, thanks again. Sorry, I've got taking a little bit of a lag. And thank you, April, for going over kind of a lot of that CPIP completion. We're going to be diving into the specific sessions here in a little bit, but I wanted to talk a little bit about what the technical assistance provider or the CPIP facilitator role could be. So again, the CPIP tool, it's not just for reporting, it's for learning. You're gonna be having a discussion with partners in order to kind of find out how practice is going and to determine where your strengths lie and where there are areas to improve. And just also wanting to note that this TA provider for the completion of the CPIP may be from a Cal Academy. They're formerly the Regional Training Academies or RTAs. It may be from CDSS, from the CFT and CAN support unit, or could be a county designated lead who feels comfortable with the CPIP and the completion process. So the person who actually facilitates that CPIP conversation can vary, but there is assistance and support for it if counties would like to elect in that process. You can submit a technical assistance request and click a CPIP completion as the technical assistance category. And we will also talk a little bit more about that in future slides. But with the facilitator or the technical assistance provider, they can help prepare and follow up with the county lead for the CPIP, kind of assisting in identifying team membership, location, meeting time, what's needed to be brought to the meeting for the discussions, to document to help with documenting the agreements, the next steps, the timelines, or also the disagreements. I think I saw that in the Q&A. So there is a place to document those things, and it is included within the CPIP completion guide. And that's something that the TA provider can also help with. The TA provider also helps to encourage that safe and consensus-based participation. They help get everyone involved and feeling comfortable in the process. And they also can help connect the CPIP to other improvement efforts that's happening at the county itself, whether that's the county self-assessment or the program improvement plans or system improvement plans. They can help make those connections as well. Next slide, we actually have some training on for the CPIP facilitation coming up later this month, and then another session in October. So September 29th and then October 17th. We have 4 hours designated each day, 30 to 12:30, to attend an interactive training for the CPIP facilitator. It's strongly recommended, again, for those TA providers supporting placing agencies, and also the placing agencies themselves if they have an identified CPIP lead. Participants will build confidence in using the CPIP completion guide, gain clarity on the CPIP requirements and their role in the system improvement planning, and practice engagement strategies for working with the interagency leadership team members. Which includes navigating maybe reluctance or challenging questions as well. The way that this is kind of set up is a lot of bit like the CFT and IP CANs process, right? The ILT and the placing agencies team is that CFT, and the CPIP is the CANs or the IP CANs, where it has those ratings. So there may be reluctance, or there may be challenging questions and things like that. And how do you navigate those? Well, this training can kind of help you get those answers. It also helps, it's drawing on the expertise of seasoned technical assistance providers. And also the session connects the CPIP work to some of the statewide IP CANs and CFT policies and Fidelity efforts. And it has some hands-on learning opportunities and resources for ongoing support. We have additional learning lab types for those facilitating these conversations and things like that as well upcoming. So there is support for completing this, and I just want to highlight that in multiple areas. So the training, and I'll also say the training originally was entitled the TA provider training, but we've updated that. But if you click on the link to register, you will see still the TA provider training, but please do still register for it. The first is a pilot, so the second may shift a little bit as a result of what we hear from that pilot, and then we will be offering additional sessions as the need arises, and we are getting them scheduled. So we can move forward from here. But yes, resources available. Exciting. So we know it's a lot, but we are trying to come in here with some partnership with you. And I'll pass it on back to April so we can dive into what session 1 and session 2 actually look like.
Thanks, Robin. Before I go into the session 1 and session 2, I just want to reiterate that the training for the CPIP facilitation, training, those 2 dates are going to be the same training. The second one might adjust a little bit based on what we learned from the first, but they are the same training. Okay, so you don't have to sign up for both. In fact, we'd encourage you not to, so that we can make sure we have room enough for all those that want to participate in that training. And as Robin said, we will also make more of those trainings available. Okay. So going back to the CPIP and the suggested 3-session model for completion, let's talk about session 1. So session 1 lays some of the groundwork and begins that brainstorming and consensus building process regarding the IP cans and CFT practices across the county. It's really about understanding the context, building trust, and reinforcing that shared understanding of our work with our youth and families in the county. So this session may involve additional team membership discussions: who's at the table, who's missing, who should be included in further conversations. And by the end of the session, we hope that the team members will be able to do what's listed on this slide: describe the purpose and structure of the CPIP and how the CANs and CFT data collected will be used in this process, be able to apply that strengths rating scale, and understand how consensus building supports this collaborative teaming process in doing this gap analysis, and reflect on current IP cans and CFT practices to identify what are the strengths and what are the worries and opportunities that are going to inform CPIP completion. If I could have the next slide, we can talk more about how we're going to do that. So in addition to talking about the strengths rating scale, informed consent, consensus building, which I mentioned earlier, all of these things are introduced in this first session. Additionally, we want to make sure that we're supporting the development of this particular team, right? So talking about group agreements can really increase the trust and comfort with open conversations and expressing concerns and disagreements. We want to help the team identify their why the CPIP. This will allow the team members to share their desired outcomes for youth and families that they serve. We want to facilitate a team discussion on the county's current CFT processes and IP cans practices around 3 basic questions. Number 1, what's working well? Number 2, what are their worries? And number 3, what needs to happen in order to improve practice? So these discussions can really support, again, trust building and open dialogue. It helps note themes for moving forward into completing the CPIP, right? Time will also be spent introducing the CPIP itself, right? Doing a deep dive, providing an overview on what does this thing look like, what's the purpose, what's the intent of the tool, walking through the CPIP areas, and walking through the different, just giving an overview of the topic statements. So helping people understand why there's numbers and letters and how the whole thing is sort of organized. There'll also be time to talk about what's going to be done with the data collected on the CPIP. At the end of that first session, we're going to encourage homework for the team, right? Pencil score or do a draft scoring of the CPIP so that when you come to the next session, you'll be ready for those discussions. Have the next slide. In session 2, we're going to move from reflection to rating and consensus building. which will then set the stage nicely for the planning session, which is session 3. So here is where the strengths-based rating scale will be put into action. We're going to make sure the team is engaged in that consensus building on the topic area statements by sharing their perspectives, which might be disagreements, right? And working through those disagreements. And as you know from using the CANs, using the rating scale can be really helpful in those instances. And by building consensus, making sure all voices are reflected in the decisions around the ratings. The team will be supported in their participation in that review and documentation of the CPIP ratings. Again, making sure agreements, differences, and next steps are captured. So how do they do this? If we go to the next slide. Whether or not the team is meeting together in a room or virtually on a call, we want to make sure the CPIP tool is visible and shared so that everyone can see it, so that we can capture ratings in real time and discussion. There's areas to write notes. The team is given time to review, share stories and experiences, and come to consensus on the rating for each topic statement through a voting process. And as previously noted, a pencil-scored CPIP can really be helpful in this part of the process. It can help you make sure you remember things you want to share with the team around particular topic statements. Consensus will be brought up again, and how differences of opinion and the fact that differences of opinion will happen. As the topic statements are reviewed, we want to normalize differences, and that consensus does not mean 100% agreement. Robin mentioned this earlier. We recommend that the team work together on the system of care topic area. Each placing agency may be at a different stage of their CFT or their IPCAN's implementation and practice. So the practice and the data topic areas may be rated separately by the placing agencies. Despite that, we want to note that it may be helpful, for example, for juvenile probation to be present while child welfare discusses the practice and data topic areas, and vice versa. Important learning from implementation and practice applications are likely to be shared by one placing agency during these discussions that can be helpful to the other placing agency as they reflect on their implementation and practice. Additionally, right, in addition to raising awareness of each other's system process and seeing the potential for more integration, which is always the goal, common strength building efforts and shared strategies may likely emerge from these joint discussions, which is why we recommend you do them together. Next slide, please. As I mentioned previously, we're going to provide an overview of session 3 in the next webinar on October 9th. For now, I'm going to end my section of the presentation by pointing out some important supports that you're going to find in the appendices of the CPIP completion guide document. In Appendix A, we have, which we fashioned after the CANs, actually, it contains questions to consider for the topic areas of the CPIP. The CPIP facilitator or even the team members themselves can use this appendix as a reference point. The questions to consider are facilitation prompts for each topic area and can also help the team dive deeper into that particular area. Additionally, we've listed potential data sources for each of the topic statements in this appendix. The list, however, is not exhaustive. Appendix B lists the CPIP topic areas and then also identifies the associated coaching and technical assistant guides that were developed. Robin mentioned these earlier. These guides will be really helpful, again, as references and also as potential strategies to address the gaps that have been identified through the completion of the CPIP. There are 22 guides with accompanying materials, which will be reviewed in more depth at our next webinar. So that was a lot of information. I want to thank you for your attention, and I'll turn this back over to Robin.
All right. Hi, all again. And thank you for that, April. Well, I'm going to dive in a bit more to what those data sources are as well. As discussed, the CPIP is organized into those three categories: the system of care, the IP cans and CFT practice, and data. So we have those three sections, and you can see there's a lot of different documents that may be available for to inform the completion of the CPIP. It's not just based on one data set. It draws from multiple sources to ensure that the planning is really grounded in evidence, in practice, and into the system level insight. So it's looking at a variety of documents here. We look at the system level, what happens in the practice with the families, and the data then shows the outcomes as well. And it provides kind of that balanced approach and overview. It's also important to note that some of these data sources may not actually be available for the initial CPIP submission. Those tools include the IP cans and CFT Fidelity tools that have either just launched or are going to be launching in the near future, perhaps even after the first submission. And I'll talk about those specifically in a couple slides. But if the data source is not available, there are additional sources. CFT meeting notes and other interviews can be used in their place as well. And then placing agencies with access to safe measures can view data for both IP cans and CFT practices. And same goes for the CCR dashboard. The CCR dashboard is more public facing, as is the California Child Welfare Indicators Project. So the system of care sources reflect how services are structured and kind of governed, like the policies and procedures and agreements, like the 2083 or the AB 2083 MOU shows how counties organize things. And so meeting notes also can capture leadership discussions and direction, ILT notes. And then together, these sources highlight system accountability and their readiness. And then the practice section, these sources happening day to day, which the observation tools and the survey show family experiences, the action plans and Fidelity reviews tell us, well, whether the practice is matching expectation and policy as well. And then with the data section, the reports there provide kind of actual numbers, right? That's where you'll find the different dashboards, the state and county indicators, certification reports. These sources actually help us measure progress, track outcomes, and identify the trends that require attention or our strengths that we can build on. When we bring these three lenses together, the system, practice, and the data, we get a full picture of what those strengths and challenges are at the county. The CPIP really relies on this integrated approach to drive meaningful and measurable outcomes. So it's important to be using the data sources that we have available to inform it and to be using them as part of the conversation as well. Next slide, please. So we'll be diving in a little bit more about what some of these are. So this is the documentation review section of the CPIP data sources. The documentation review includes things like the ILT meeting minutes, the established county policies and procedures, the 2083 MOU, communication materials, CFT meeting notes, and other meeting minutes. These are planning and communicating. Again, the ILT and other meeting minutes can help reflect some leadership discussions. The policies and procedures and MOU show agreements and expectations that are in place. Communication materials indicate how counties share information with staff and families. Meeting notes also highlight how decisions can be translated into practice. These are generally internal documents that may be utilized by placing agencies and their teams when completing the CPIP, but these documents are generally found internally. Next slide. We also have our survey data. So that includes the CFT meeting survey, action plan, meeting observation tool, and the IPCAN's Fidelity review tool. And just noting again, the IPCAN's Fidelity review tool is still being finalized and is not yet available, but it will be coming out in additional guidance, in future guidance as well. Data sources here. Provide perspectives, from both staff and families, and they also help us measure the practice fidelity. The meeting observation tools and action plans and surveys kind of tell us again how those meetings are experienced and what took place during the actual meetings. And then the IPCAN's Fidelity review tool will be critical for ensuring that the practice aligns with the standards and the expectations. And again, that tool will be utilized by CDSS when it does go live. And a few slides ago, I did mention that some of these data sources may not be available for the initial submission of the CPIP. This likely includes a number of the sources that are actually on this slide here. Some counties may have implemented these tools already. The CFT meeting survey has been up and running. The CFT action plan has been available. And many counties use a version of a CFT action plan as well. Some counties have already began using the CFT meeting observation tool that actually came out a number of years ago and was piloted as well. So some of these tools have actually been available and around, and some counties may be utilizing them already and may have access to the data. That said, some counties may not have. And so that data would not be available yet. The CFT meeting survey may have some data available since its use began earlier this month, and that would give maybe a few months of data. But the CFT action plan is beginning January, as is the first submission of the CPIP. So if a county is already using the CFT action plan, as well as the meeting observation tool that starts in April, then data won't be able to be found for those just yet, but that would be used in the next round of CPIP submission. So the January 2027 submission, I guess, would be able to utilize those. So I just want to highlight that, again, not all sources will be readily available to all counties right at the first submission. But you can consider the first submission to be informed again by the other tools like the meeting notes and things like that, or other sources, I mean, not tools. All right, next slide. All right, these are the data report. So again, this is kind of where we see those numbers, both at the state level and the county level. The CCR dashboard is a public facing dashboard. And then Safe Measures is available to counties with contracts, and that helps to give us real-time and trend data. The Child Welfare Indicators Project adds a statewide comparison aspect as well. Then there's also likely some counties have their own continuous quality improvement and additional local reports that will allow for additional county-specific analysis. And then there's certification reports on the IPCANs. That is just ensuring that the IPCANs is completed by someone who's maintained their certification, which is vital to the fidelity of the IPCANs completion, is that it must be completed by someone who is actively certified. Slide. All right, so the levels of support, this is something that I touched on a little bit earlier. Level 1 and level 2 are already live. Level 3, we're anticipating will go live in July 2026 of next month. Level 1 is that universal support that's available to all placing agencies and their partners. It's just simply that they can access they can self-select and access the technical assistance information. They have access to the CPIP completion guide. They will have access, hopefully by the end of this month, if not the first week of October, to the technical assistance guides that will be posted online, and all the additional resources that are available to support their CFT and IPCANs practices. So level 1 is that universal support. Counties can kind of opt in and just find what they need through the online sources. Level 2 would be more of that request for individualized assistance. So that would be when placing agencies or their partners are completing the technical assistance request form. I believe it's been put in the chat, and I know I attached it to a number of the Q&A and responses as well. So the technical assistance form is an online form that can be submitted, and it does include a number of different technical aspects. Oh, I'm sorry, we can go to the next slide as well. That just highlights the next level too. It just moves the orange box to the next level, I believe, as I'm speaking of both of them. The level 2 is, again, it's where you complete that technical assistance request form, and that request form, thank you, Joanna, I see it's added to the chat, is available and live already. And we encourage folks to submit requests now. Do it early. If you anticipate that your county may need help with the CPIP completion, submit it now. Let's start that process. There are people here that are available to help. And we can kind of all, walk through it together. It's a journey for all of us. And it's the first time any of us are going to be doing the CPIP submission, including those TA providers, including us at CDSS, including, obviously all of you at the county and partner level, and our families. So it's a new process, and we really do want to come in as a partnership and work together through this, in order to help counties reach their fidelity. I say that, and then on level 3 is that intensive engagement and assistance. We are still coming in as a partner, but starting in July 2026, CDSS, specifically the CFT and CAN support unit, will may begin reaching out to counties if we identify a need specifically looking at CCR dashboard information, the CFT and IP CAN's timeliness of out-of-home cases, initial out-of-home cases. So if counties are not at that 90% threshold, if they're lower, we may begin reaching out to offer support and help identify barriers and see where we can help with these improvements, so that we are really hopefully at a place by the time the tiered rate structure is in 27. So we're hoping that we're coming at this. We know it's a lot and we know it's kind of fast, but we also know that we need time in order to gear up for additional things that are coming. And we want to make sure that we have time to walk alongside you and to provide that assistance and to get counties to where they need to be as we move forward. So just highlighting those two things. We can go on to the next slide, and it actually talks about what the areas of technical assistance are on that technical assistance request form, right? So you see that third box in CPIP completion assistance. I'm highlighting it again, but you also see there's a lot more on there. You can go on and request assistance for the CFT median observation tool, for both CFT and IP CAN's practices, for system of care issues, if there's training needs, if there's data needs, if there's if it's related to IP CAN's and CFT work, and you need assistance or support, please hop on, fill out a technical assistance request form. We are hoping to be able to support, and we would like to have submissions sooner rather than later. Because if we get a lot of CPIP completion assessments, December 15th, we've got 2 weeks to complete them all with, 30 counties, or, I'm making things up here. But it's just, there's a point to it though, right? Getting your technical assistance request in early means we can start that process early. It means we can be meaningful about it, right? We can really engage with our partners. We can really talk about the issues and plan and strategize. And with the support of either a Cal Academy technical assistance provider or CFT CAN support unit. It's a new name for us, so I'm getting used to it. The CFT and CAN support unit workers as well. So when a county or partner submits this request form, it actually gets sent to both the Cal Academy and the CDSS representatives. So it's sent simultaneously to both of us, and then what we do internally is coordinate a response and reach out so that we can assess together and determine the best route forward alongside the county. It would start with more of a conversation of what those needs look like and things like that. So Again, that technical assistance form is live and available for submissions. I think we've received maybe 2 of them so far. So exciting, but let's bring more. All right, then we also have all of our continued wonderful upcoming Fidelity webinars and learning labs. You can see we finished our first webinar and learning lab with the little check mark there in the bottom right of the box. That was on the IPCAN's completion and Fidelity requirements. We provided an overview and dove into the CFT brochures and CFT survey at both the webinar and the learning lab. And then, as I've said a couple times, both this webinar, the learning lab, and the next webinar and learning lab are both focused on the county practice and improvement plan, or that CPIP. So today we did go into the CFT data sources. I encourage you all to also register for the learning lab on Wednesday, October 1st. That's 11:30 to 1. We do a very high overview of what we discussed here, and then we do a deeper dive into some of the specifics. And then again, register. Well, I mean, I encourage everyone to register for all of them, right? Of course. And then the next one is kind of the development of those CPIP strategies. So if you look in the CPIP completion guides, there's a third session, and I know April talked briefly about it as well. We'll be diving into what that third session looks like and how the development of those strategies can also the technical assistance guides that'll be available by then will also be helpful in using it to inform the development of strategies and things like that. So we'll dive deeper into that at the next webinar and learning lab. And then we will be diving into the CFT meeting observation tool and CFT meeting summary and action plan at the 4th webinar and learning lab. And then we're going to be shifting to more of the available resources and data supports that are available at the 5th. We also at the learning labs try to incorporate more Q&A as well. We have a few minutes here, and we're also going to have some feedback. But I know the learning lab specifically, we encourage a lot of those to bring your questions to us. So you can also email them to us in advance. You can submit them in advance, so we can. We always appreciate that, so we can make sure that we can research and find the answers if we don't have them right away, so we can provide those answers in a moment. So thank you again for all joining us here, and I will pass it on back to Emma.
Thank you so much, Robin. We have answered 36 questions through the Q&A feature, so if you have not had a chance to look at the questions and answers, please do. We collect the questions and answers provided from every webinar and learning lab. We are putting them onto one collective document that we're working on getting hyperlinked to the Fidelity series website. We're also working on being able to just send out a copy to you all, because I know that some folks have issues with accessing Box. But lots of great answers provided through the chat. And again, we really encourage you to come to the Learning Lab. We really focus the Learning Lab around digging in deeper around some of the things that came up today as themes around questions. One of the things I just want to uplift and highlight is that we will have more guests and speakers coming to our next webinars. So our next webinar will have a phenomenal technical assistance provider, Shelley Paul. She has supported counties across the state of California with their IPCANs and CFT practice and Fidelity. We will also have a county that has been able to utilize her guidance and support, talking about their experience. The CFT meeting observation tool and action plan and summary webinar, myself and my phenomenal partner, Joanne Pritchard, will co-present on the development of the meeting observation tool, how it can be used, and how you can really facilitate a meaningful debriefing process that really helps to advance practice. And then we will wrap this series up with just kind of everything else that is coming up during this period of time. What are the additional Fidelity resources, data, etc. And we will be offering a longer learning lab following that webinar, with anticipation that hopefully by then you all are really digging into the CPIP process and you might have some good questions that you want to bring to that learning lab. So we hope to see you again. We hope you will continue to join us. And typically, I would love to field some live questions, but we are tight on time. And part of what we have committed ourselves to do in this series is to make sure that we seek and receive feedback from you all about how each of these events are going, because part of what we want to do is to be flexible and adaptive in the moment. So if anything about our process and structure today did not work, well, guess what? We get to do it 3 more times. So we will change it for next time. So just ending here with a slide that provides some resources where you all can find more information, more guidance about what we are up to and what we can offer, as well as a plug to email the CAN CFT support unit. If you would like some support from them or have additional questions, their email is cwscoordination@dss.ca.gov. And next, I'm going to invite you back onto Mentimeter. So again, if you can scan that QR code, go to menti.com, use code 5230-3374, or I think my amazing partners probably, yep, she's got the link in the chat. So hop back onto Mentimeter. Again, our intent here is to get some feedback from you all about today's Fidelity webinar. We would love to know what worked, what can we change or do differently. This is another one of our parallel processes. You heard April talk really beautifully today about the CPIP being a parallel process to the CAN CFT process. Well, we're bringing in a little bit of that here today too with our webinar series, because we want to know what did we do well and what can we change and do differently. So it looks like quite a few of you have joined. Thank you so much. I'm going to advance the slide. So I'd like you to rate on a scale of 1 to 5, how useful was today's webinar in helping you to understand Fidelity requirements for IP cans and CFTs, with that 1 being that it was not at all useful. You could have done something else with this time. And a 5 being that it was extremely useful. You walked away today feeling much more aware of what the requirements are and the timelines are for implementing them. So given a moment for folks to respond. All right, looks like we've kind of all over the place around a 3.9. So thank you so much for that feedback. Oh, a 3.8. Please rate your increase in understanding of the following Fidelity tool, the County Practice and Improvement Plan. How much did your understanding of this tool increase? From not at all to significantly, feeling like you understand it much more. Looks like we're kind of all over the place, floating around. It looks like a 3.3, so seeing some increase in understanding of that tool. Thank you. What aspect of today's webinar did you find most useful and why? So this is an opportunity to provide some written feedback, letting us know what about today was most useful. I'm just going to respond to this quick one in the chat. Patricia, you can access all of the links to attend any of the upcoming webinars at that Fidelity website. So it looks like people appreciated hearing from Richard, links, understanding the timeline, an inspiring presenter, getting a sense of the requirements, resources, due dates, getting that connection to the system of care work, links, documents, and lots of gratitude for the Q&A. So thank you so much. Do you plan to attend the follow-up learning lab on Thursday, October 1st from 11:30 to 1? Looks like quite a few of you do plan to attend the follow-up learning lab, so that's super awesome. We will be very excited to see you again in October. Looks like some folks can't attend, some of you are maybe on the fence. We did our first one last week, I think. I don't know, it's all a blur. And we got really good feedback. People said overall that they felt like the structure really worked. It was helpful. So we're probably going to mirror that same structure, but we're going to ask for feedback in that learning lab as well. So if there's anything we can change or do differently, if you come to that one and you've got some strategies on how to make it better, please do let us know. And then finally, are there some, no, sorry, I think I have one more question. What questions would you like addressed in the learning lab? So for those of you who are coming, you're signed up, you're going to be there. What can we make sure to talk about in that learning lab that will help to offer more understanding and clarity? And if your brains are a bit overwhelmed right now and you're just not quite sure, that is okay. Ooh, I like this. The role of the line worker in the completion process. Again, maybe some templates for policies. Folks would like a copy of Richard's PowerPoint. It should be in the materials link. If it is not, let me know and we can add it. How do we manage up? Ooh, role playing, a CPIP work group session. Okay, that sounds fun. And maybe just kind of exploring some things around how we engage. All right. Anything that we can improve for our next Fidelity webinar. So when we host our next Fidelity webinar, anything that we can improve, change, or do differently. Not so fast, feeling like we need to slow it down. We tried to go a little slower today, but it's a lot to convey. Appreciate that feedback. Maybe going slightly longer. Add engaging, anything if possible, hands-on samples. Maybe not so many links in the chat. We are going to work on a document that has just all the links because I know that we're bombarding you all with links in the chat. So that's another thing we are working on from today that we will send out. So if you're panicking, thinking you didn't collect all those links from the chat, we will get those to you. And again, just some thoughts around pacing, maybe having a longer break, examples of those county approaches, a little more levity, more ability to engage in different ways. Awesome. Thank you so much for your valuable feedback and for really providing us with some concrete suggestions for how we can continue to make this process as impactful and good as possible. We're at 12:01. One of my strengths is to try to start on time and end on time. So we're going to wrap this up. Thank you so much to Robin, April, Richard, and to everyone else for presenting and for joining us today. And we hope to see you soon.